So I have some dental advice for my endodontic colleague. So I had an endodontic colleague that asked me, I have a dentist who needs a root canal but never refer me patients. Should I charge them? So that's a very fair question. It really depends on a few factors, both strategic and ethical. But this is a little breakdown that I use that can probably help you decide should you charge them or not. Well, you have professional courtesy and also you have business reality. So traditionally, some endodontists, they offer professional courtesy, discounted or no fee to colleagues, and usually that's for good referring doctors. So if you have a good referring doctor that sends you patients, then absolutely don't charge them. However, courtesy is not a rule, it's a choice, and it's usually extended when you have a mutual relationship. Now, if the dentist does not refer to you and they consistently send patients elsewhere or even keep the endo in-house, they're operating more like a regular patient than a referring colleague. In that case, you are not obligated to offer any discounts or any courtesy. So charging your standard fee is completely appropriate and professional. So the question is, can this potential doctor become a referral opportunity? The question is it someone you want to build a relationship with? Well, if it is, then treating them with this kind of courtesy may open the door. But in my experience, I found out if they're not referring you patients before you do the root canal on them, they're not going to refer you patients after. And I always ask the question, I'm like, wait a minute, why aren't you sending me your patients, but you are willing to come to see me for your root canal? And that just boggles my mind. I've been doing this 25 years in my own practice, and I still don't understand how can a dentist come to see you as an endodontist for their root canal, or even send their parents or their spouse, but yet they send cases elsewhere. So I just wanted to spend some time to kind of give you some tips on that. Well, you're not obligated to give free treatment, especially to a non-referral. But if you want to establish a relationship with a new referral, it would be good business sense to either not charge them or give them some sort of a discount. You say, well, Dr. Short, well, what kind of discount? Well, you can start with this. You can start with this as a rule of thumb if you want to have them as a good referral. Number one, you cannot charge them for the consultation. You cannot charge them for the 3D image. And if they need a root canal, okay, you can take off anywhere between 10 and 25%. And I think that's fair. However, if you don't think they're going to refer to you, and you may not even want them to be a good referral, they may be I call them a bottom drawer type of dentist, and then professionally you charge them just like a regular patient. So hope this helps some of you guys, because I get this question asked all the time. You have a dentist who needs a root canal but never refers. Should you charge them? So hope you got something from this wisdom that I've been able to accumulate for the past 25 years being in private practice. Take care.